to PC730, to our live library session with our illustrious librarian, Billy Ann, who we're so glad to have. And of course, glad to have all of you. I love these library sessions. I think they're really fun. And I always tell the story at the beginning of them that I put what seemed like 1,000,000 hours of literature search into my DNP. I have no idea how many, but I thought it was like way excessive. I thought I had spent more hours researching than any human alive. And then I spent about 20, maybe even 15 minutes with a librarian and changed my world, changed my search, changed everything, found things I didn't know existed. So I was so excited to get into this course and realize it's just built in. Everyone gets a couple of minutes to figure this out. If you don't know how to use things like mesh terms well, if all of this stuff feels overwhelming and you're not really sure how to find the evidence you're looking for, this is the place for you. It's gonna be perfect. All right, so since you guys don't know each other very well yet, and we're at the very beginning of the term, I just wanted to start off by having you very quickly say your name, say your topic, something like that. So if I think everyone's pictures are in different orders for all of you, but for me, Alan is on the far left. So Alan, if you want to start. Oh, you know what, Alan, we can't hear you. Okay, now I see that you're muted. I'll give you a minute to work on that. If you can't figure it out, you can always try going out of the room and coming back in. Sometimes that just solves it. All right, so next we have Cynthia. Cynthia, I'll let you introduce yourself.
Hi, I'm Cynthia Armstrong. I'm a women's health nurse practitioner in Springfield, Missouri, and I plan to do something on low-income postpartum visits. I work in a family practice residency, and we have a horrible time getting our moms to get back in for postpartum care.
Excellent. Yeah, that is a common problem. That's a good one. Jennifer, you're up.
I'm Jennifer Crome. I'm a family nurse practitioner. I just moved to Tennessee, which is where I'm from. I was in Hawaii for the last 16 years. And I am doing my project on antibiotic stewardship in the treatment of UTI.
Excellent. Rachel?
My name is Rachel Sparks. I live in Arlington, Virginia. I'm a family nurse practitioner, and I'm doing my project on diabetes management and possibility of like an implementation of an educational program for self-management.
Very cool. And Sarah?
Hi, everyone. My name is Sarah Sparks, and I am a family nurse practitioner in Boise, Idaho. And I'm going to be doing my project on increasing the rate for HPV vaccinations with a shared decision-making model and working on using a screening and brief intervention and referral to treatment. So we screen every patient for the vaccine and then hopefully increase our HPV vaccination rates.
Very nice. Alan, if you're still not able to, if we can't figure out the sound thing, why don't you try just going out of the room and coming back in? Sometimes that just works wonders.
Yeah, because it almost looks like he's like frozen too. I don't know if it looked that way for anybody else, but like maybe his connection wasn't quite working.
Yeah, and his equipment was all working here just 5 minutes ago.
How it always goes.
Yeah, that's frustrating.
All right, so we're doing this. We've got this small working group getting together with our librarians for the purpose of really helping you guys figure out information literacy, helping you figure out how you really use the library well. How do we get to the best data? I know you've done some searching up to this point, but a doctoral project requires a whole new level of good research. So we're here to help. So up to this point, you should have done about 20 hours of literature search. Oh, and here Alan is back. Let's see if we can hear him. Oh, no, we can't.
Oh, and there's Joy.
Thank you. So sorry. I don't know what happened.
That's all
I'm
right.
here.
We're glad you're back. Joy, will you just tell us really quickly your name, where you're at, and what kind of project you're doing?
Hi, I'm Joy Brock. I'm in Los Angeles right now, and I am working in a long-term acute care hospital with nursing, evidence-based practice nursing with sepsis assessment, sepsis screening. The population that we work with is post-critical care, high risk for sepsis recurrence. And with early detection, we can save some kidneys and prevent a readmission to the ICU. So it's implementing the screening tool from the Surviving Sepsis campaign. That's an actually international effort.
Awesome. That sounds fantastic. All right. So our only problem left is Alan's sound. And Alan, honestly, I don't know what to do for you. Billy Ann, do you have any suggestions?
Try unplugging your. So, is the microphone on your headphones, or is it a different type of mic? Because one thing that I always have to, you can check in the settings, that little gear icon up at the top, and make sure it's looking for the right microphone. Sometimes that can cause a problem. And now you are on mute.
So Alan, right now you're muted. Can you hear me? Looks like he might be.
Okay, he said he can hear perfectly if you want to keep on going.
Okay.
I'm going to keep working on it rather than.
Okay,
yeah.
Sounds good. So sometimes that little gear icon will help, but we'll see from there. All right, so Billy Ann, do you have anything you'd like to say to start off?
No, not really. I had just a few minutes to look at your Pico sheets that you guys just turned in. So I did take a look at those. Looks like we have a lot of interesting and exciting topics. But really, what generally works best is just for you all to tell me what you're struggling with, and I can, suggest strategies or terms or whatever that might help.
Okay, awesome. So at this point, I'm hoping that you guys have put about 20 hours or so into your literature search, so you kind of know where the holes in your search are. You know where the thing is that you'd really like to find, but you haven't quite been able to find what you're looking for, or whatever that is. So does anyone have any pressing questions that they want to start off with, like something that for their particular search just isn't working for them?
I have a question.
Okay.
So I was doing a search on antibiotic resistance and antibiotic use with UTI treatment. And when I got to the part of the checklist that was the 6 aims, and it says like specifically search each work and your topic, like safety and UTI or timeliness and UTI. I couldn't really come up with anything when I was searching those specific terms. So I wasn't sure if I wasn't doing it right, or if I should be wording it differently or what.
Okay, Nisa, can you tell me a little bit more about what it is they're supposed to do for that part?
Yes, so it's a worksheet that just takes them through different search exercises. So that's one of the exercises, is to take the IOM 6 aims, which are like timeliness, efficacy, those kinds of things, and kind of apply each one of them to their project and see what kind of information they come up with.
Okay. Okay, and so you used antibiotic resistance as a keyword, and then just used all those different aims as a second keyword?
Well, I used the first keyword as UTI, and then did safety and timeliness and efficacy and that kind of thing.
Okay, yeah, you probably have too many keywords in there, and that would be why you didn't come up with anything. I would start with, so let me go ahead and share my screen here. Just a second. So let me back out a little bit. So I'm in EBSCOhost in Medline. And so I went to MESH 2017 up at the top to see what the preferred term for antibiotic resistance was. And so they actually use drug resistance, microbial. So one thing that might help with some of these are the subheadings. It doesn't look like that's the case for any of these, but let's go ahead and do. Let's use this term. I'm just trying to. I think if we combine this with UTI and then start adding the other things, that might still be too specific, but I don't know. I mean, you could just, at least I think so for this assignment, you could look at the timeliness, efficacy, and all that different stuff just of antibiotic resistance, because that's kind of a topic in and of itself. But let's do the drug resistance microbial with urinary tract infections and see how many articles we get, and then see if we think we can add those other things in. Yeah, so actually, let me back up just a second. So EBSCOhost really doesn't like it when you use the back button. I do, especially in these sessions, I will use it occasionally just because it is shorter, but keep in mind that might sometimes give you trouble. So timeliness, efficacy, what were the other ones?
Safety, effectiveness, equitable, and patient-centered.
Okay. Safety. Patient-centered. Okay. Timeliness, I'm still missing one. Timeliness, efficacy, effectiveness. There's effectiveness and efficacy?
Yes.
Okay.
I don't think there's both. Let me double check that.
I think it's efficiency.
Yes.
Oh, thank you.
Oh, sorry. Trying to trick you.
Very close, yeah.
Yeah.
It is very close. While Billy Ann is doing that, can I just tell you guys, I have like a major soapbox about the word efficacy, and I just thought that you all would probably love to have that shared with you right now. I would just assume the word efficacy be struck from the English language at this point, because it's so extremely difficult for people to use it well. But when you think efficacy, if you will just think effectiveness and try to sub those two words out for each other when you use it, because generally what people accidentally do is when they see efficacy, they think efficiency. And while the meanings are similar, they're not quite the same, and then their sentences don't make sense. And sometimes then maybe it's even used interchangeably so that their grader is quite confused by the end. So
valid point, very valid point. So yeah, here we have a lot of articles with the drug resistance and UTI. So I mean, now they go back pretty far. We're not going to look at all those, but yeah, I mean, we could just, like, I'm sure if we do safety, we would come up with something here. Yeah, so that brings it down to 45. But I'm not sure. If these are really what you're looking for.
So I think that is helpful though, because I wasn't searching for that quite in that way.
Are you guys hearing echo?
Yeah.
Is it me?
Yeah, I was going to say, but I think it's Alan. I'm not sure I want to go on mute. But he didn't. He couldn't talk before.
Can you hear me now?
Yes, we're very glad to be able to hear you.
Okay, so I'm going to go back on mute, but it's like I'm going to kind of go on and off that way. So
Awesome.
Okay. Oh no, I still hear the echo. Okay, yeah, okay, that's better. Thank you. So one thing I do want to point out, you guys may be familiar with this already, it seems like a good handful of these articles are in a non-English language, and I can tell that just by looking at them, because if they have these brackets around them, that means they're in a language other than English. So we can get rid of those over here. We can limit to English language. So I'm sorry, Jennifer, to get back to what so you said you thought this was still helpful somewhat because you hadn't been using the mesh terms.
Yeah, I was using the mesh terms because I did my big search, like with what you did, antimicrobial resistance and UTI, but then I guess I just wasn't using both of those terms with safety or with effectiveness. So maybe that's where I was going wrong.
Okay, gotcha. And that's and yeah, that's because you can, a lot of people, you may not have realized, and I can understand why you wouldn't have, that you can kind of combine, you know, when you go through that mesh interface, it will put your search here in this line for you, and then you can add keywords from there. So a lot of people don't realize that you can kind of combine those. So yeah, if that would help to get closer to what you were looking for, you can certainly do it that way.
And then I'd like to ask a question really quickly. Does everyone understand why we're looking for these 6 aims? I want to make sure it's clear that as you're going through your project and designing your project, one of these 6 aims will be foundational to your project. And so as you're searching, as you're developing a plan, you will find that either your entire project is structured around safety or around patient-centeredness or around efficiency or whatever. And so one of those words will actually be in the title of your presentation and will be foundational to the presentation or to the project itself. So you're gonna, so as you're looking, think about which one of these terms, which one of these 6 aims fits best as like a foundational theme for your whole project.
Yeah, and the other thing, so with those, and also with those terms, you know, some of them will have their own mesh terms. So again, you can, you know, try and do the whole thing as mesh terms. You might want to try it both ways, you know, especially if it's going to be, you know, really integral to your project. So like patient-centered care has its own mesh term. So we could, you know, so like I can, what I'm doing now is I'm just searching on that term, even though that's not what I want, because I'm going to use my search history so that I don't have to go through that whole thing again. So like now down here, for some reason I did it twice, but so I've got patient-centered care up here, and now I can say I want to combine that with search 2, which is when I just did drug resistance and UTIs just by itself, and so I can search those with and that didn't work, but that is a way to combine searches if you need to do that and you don't want to rebuild the whole thing from scratch. The other thing that you can do, so here are those like 1,600 just with drug resistance and UTI, but if in the case where we're not sure what word people would use, like we could do efficacy or effectiveness. So we're going to get either of those terms combined with both of these terms, if that makes sense to everybody. So again, I don't know. So we get 170 doing that one. But you know, there may be a mesh term that gets at that idea of effectiveness better, but that's one way to that's one way to do it, and one way to use your or operator in order to get either case there.
Does everyone feel really clear on how to use mesh terms? Have you guys been using them up to this point in your search?
I watched some of the recordings that I think it was Zach that did it to like take you through it. And I found that that was really, really helpful. And like he did it in a really organized manner that I was able to understand too, just like you did too.
Okay, great.
I do have to say, you know, using the mesh terms, maybe it's just my topic, but as I include the terms that they tell me to include, it does change my topic search a little bit. And the other day, I don't know if it was just because I was tired, but I was completely confused by the time I was done. So, you know, for example, I'm looking at long-term acute care. Well, when I put that into EBSCOhost, I didn't get anything. Sepsis screening, I didn't get anything. So I went in and looked at what they were. They said, look at acute care. And I thought, well, let me see if I can get that. Or long-term care, which is different. That's a skilled facility. So as I've used the mesh terms, it's really kind of changed the intent of my search.
Okay, well, that shouldn't be the case. One that you have to keep in mind that when you type something into EBSCOhost, you type in long-term acute care, it's looking for that as a phrase. And so with that, you know, you also have to keep in mind that, you know, some people, you know, is there a dash between long and term? Is there, you know, people might have said it in a different phrase, so it will look for that as an exact phrase, and so you will get, you know, some things, but that might not be, you know, what the mesh term does is it should, no matter what terminology the author uses, it should be indexed under the term that that they've picked as the preferred term. So were you not able to find a mesh term for long-term acute care? Was that the problem?
Yes, that was one. But now that you mentioned it, I can't remember if I hyphenated long-term acute, long-term, and that it might have been something that basic, and it just didn't occur to me. So I can take another look.
Right, and so that is, you know, part of the appeal of using mesh terms is that you don't have to worry about that, you know, whether or not there's a hyphen and that kind of thing. Now, there is a problem with subject headings in that they don't update quite as quickly as what our language, you know, they don't evolve as quickly as our language evolves. So, you know, it could be that it could be that they don't have a term, because in fact, I am finding it strange that they don't have a term for acute care. Oh, did I just type in acute care?
Joy, I have a question for you about long-term acute care.
Yes.
So when you say long-term acute care, I mean, I think you're right. It immediately brings up to me, acute care to me means something like an ICU, and long-term care means something like a, you know, skilled nursing facility or, you know, outpatient, some kind of facility. So when you say long-term acute care, do you mean long-term in-hospital, like step-down unit kind of care, or what kind of place are you thinking of?
No, actually, long-term acute acute care hospital is a special designation with special admitting criteria through CMS, and it is an acute licensed hospital, but because of length of stay and patient criteria, the average length of stay is 25 days or greater. And the particular facility that I'm working at is an acute care hospital. There's no emergency room, it's small, and it does have an ICU. So patients do go in and out of ICU, a lot of ventilator patients. So it's higher than like a subacute unit. It's the same license as a general acute, but it is different. And there are not that many of them nationwide. Vencor used to be a long-term acute. I don't know if you're familiar with that term. I think many of those have transitioned to subacute units, but we have 3 units in Los Angeles. There's another well-known up in Washington State, I think, and right now the name is escaping me. But it's kind of a unique niche.
It does sound like it. So what I did when I typed in acute care, it gave me, or it suggested subacute, which she just said is not what she's looking for, but
Correct.
maybe a little bit closer. So what I did was look at the tree view for subacute care to see if it would show me other things. And so what we're seeing is like patient care is more general, and then we've got all these different types of patient care, but still not one that seems to be describing her situation. Now, the other thing that you'll notice when you use mesh terms, or you may not have noticed, and I wouldn't blame you because it's a little bit hidden, but when you select it and you get your subheadings, you will also get these like used for, and so subacute care is used for post-acute. So like if you came in and did a keyword search on post-acute care, you would get some articles because that would be what people would have used. But you would have to try post-acute as one word, post-acute as two words, all that, subacute to really get everything. What this is telling us is that any article, if the article comes in and they use post-acute care, it's going to get indexed as subacute. And so that's the purpose of the subject headings. It shouldn't, it shouldn't change your search. It should get it more on topic. So I think it could be that there's not a mesh term for your particular for that particular term. But the other thing the other way that I handle this, because a lot, I'm not a clinician, so a lot of times things come up that I'm not familiar with. Like the other thing I would do is look at one of these where they do use long-term acute care hospital. They do use that term, and then I'll look for the mesh term that this article has been assigned. Now, in this case, we're not shown any mesh terms, and usually that's because the article is too new and they just haven't been assigned yet. See, this is just from last month. So I might have to go down here a little further and see if I can find one that has some mesh terms in it. The experience of chronic critical illness in a long-term acute care, critical illness. Yeah, I mean, it looks they've used transitional care, which I'm not sure is. I mean, so it does seem to be that there's not a good mesh term for this particular setting. So yeah, they're not. You found one where it doesn't work, so they aren't infallible. But we can see, just to give an idea, they've used critical illness. They've used transitional care, so those give us some things to think about. But yeah, we might have to. It looks like we're going to have to do that as a keyword. So now for sepsis screening is also a little bit difficult sometimes. So that may have been what happened there. Like there's not really the only term for screening is they use mass screening. So let's just see. Yeah, use mass screening. Okay. So if we do sepsis and mass screening, yeah, see, we only get 68 on there. So if you're trying to do that and long-term acute, that's probably going to be a little too specific. So you might have to do it kind of in phases. So you might not find one that has everything. You might just have to look at things that are somewhat close to your population.
So Joy got dropped off the call, but I'm glad that we're still recording this, so so she'll be able to see it, because I think this particular article, while it says intermediate care unit setting, the principles of sepsis are going to be the same no matter what your location is. And sepsis screening is, she's likely to find something that is really appropriate in an intermediate care unit for what she's doing.
Right.
That's what I kind of found when I was doing my search. Like the articles didn't have to pertain exactly to what I was doing. Like it could be a little bit, bits and pieces to what I was doing. And then looking at all the articles together collectively, like that has to do with my project. So it was just kind of, I had to let go a little bit and not find articles that were exactly what I needed.
Right, exactly. Oh, this looks, well, she said she already had her screening tool, but this article might be good as well. It's a little older, but validation of a screening tool for the early identification of sepsis.
Yeah, even though there are only 3 articles here, just a quick glance at all of them look to me like things that would all be really relevant.
Right.
Well, I guess not the third one. I didn't get down that low, but the first two.
Well, yeah, and this one is in Dutch, so.
Oh, that's not so helpful. Although the title is very nice.
although it does look interesting. So yeah.
That's very good. What about other searching issues, or anyone else who has done a search and feels good about it but just wants to go ahead and do a search real quick right now and see if we come up with anything new or exciting?
I have just a question regarding RefWorks. I found that it was really, really great, like with the EBSCO host, to be able to just put it right into RefWorks. But my question is, as far as like just going on the CDC website or like the American Diabetes Association, that I could be just not know where I'm going, but it didn't seem like from those articles I was able to put them into RefWorks. Is that true? Like for those databases that you just have to manually put those in?
Yeah, there is a little bit of a shortcut, but it's not a cure-all. So if you go to tools, there's this thing called Ref Grab It. And so like, it's called a bookmarklet. And so like I have it installed. So like, let's say I went to the CDC and found something I wanted to save. Let me go into an actual page here. Yeah, ADHD, that sounds good. I can click here on the, because I already have it installed, I can click on Ref Grab It, and looks like nothing is happening. It may not have liked that page for some reason. Let me see if I can get to. Okay, mine seems not to be working at the moment. So as you can see, this is why I said it doesn't complete. It's not a cure-all. First of all, it only works in Firefox. It doesn't work in Chrome. Second of all, you have to really double check what it pulls in from the website. And I don't know why mine's not working at the moment. So that, like I said, I can't even, guarantee that it's going to work for everybody. But that is one solution to using websites and that sort of thing. The other thing is, yeah, just to do them manually and enter them.
Okay, thank you.
Yeah, sure.
All right, what else is everyone else?
I'm just going to try to see if mine's working now. Can anybody hear me?
Yes.
All right, so mine is actually on pre-diabetes. And one of the things that when I type it up, it seems to give me which way to put in with the pre-diabetes. I did the mesh terms, and it kind of gives me a little bit of a, it just says pre-diabetes. I don't know where I put this, like, put it in because it's the state. There you go. But then on the bottom, you see that it gives me another, and I'm not going to say this word right, bivadines. Is that part of that? I mean, it's giving me other words, and I'm not sure. What is that? The fourth one down.
Right, I see it. So what this does? Let me start from the beginning. And do you mind to go on mute while I explain this? sorry, that's driving me crazy to hear my own voice. Okay, so when you browse for a mesh term, what you are it defaults to relevancy ranked, and I almost always leave it there. So term begins with, like, if you did pre-diabetes, it's going to, PRED, it's actually going to look with it as it's actually going to look alphabetically for your term. Term contains, it's going to look for that whatever you've typed in anywhere in the term. So like in the earlier session today, like we had labor, and that would be a good one for you to, because a lot of times things with labor in it are something comma labor, and so that might be a case where you'd want to do that. When you leave it at relevancy ranked, it's trying to figure out what it is that you mean and what it is that you want. So for pre-diabetes, it is telling us it does come up as the term, but it does come up in the list, but the preferred term is pre-diabetic state. So now this term, I'm not familiar with it either, but because it is related,
a drug category for diabetes treatment, biguanides.
Oh, thank you very much. Okay, so because it is, I assume, maybe used to treat pre-diabetes, because it is related, yeah, there we go, for the treatment of diabetes mellitus type 2 and pre-diabetes, because it is relevant, it's come up with that. And so when you're reading these scope notes, and as you saw, if you didn't see what I did, this little cartoon bubble over here, that gives you the scope note. And the scope note tells you, it's kind of like a definition, but that's not necessarily what it is. It tells you how that term is used in the database, so that what you think it means is what they think it means. So when you're reading a scope note and you see something in all caps, that means that is its own mesh term, which isn't terribly important in this one, but just so you know, that's what that means. So the scope note for pre-diabetic state is the time period before the development of symptomatic diabetes. So do you feel like that's not, I guess the other thing is too, like, that's what it gives you relevancy ranked, but also when you create subject headings, one of the things you do is, you're looking at a preferred term. So you've already, pre-diabetes is entered here. What they're telling you is, if you think you need to use pre-diabetes, what you really need to use is pre-diabetic state. So articles on pre-diabetes are going to be assigned this term. And then we can look down here at the other notes. Used for pre-diabetes, pre-diabetic state, a related heading, hyperglycemia. So, yeah, this is the term I would start out with, but tried that and it didn't quite work.
No, it actually worked. I was just wondering why that was included, and I wasn't quite sure when I wasn't checking for that actually area for the treatment. Was that just something that came up? So it's fine. I kind of understand that now when you said that. It's like much clearer. That I was like, why is that included? So that's all I was asking for. So that was perfect.
Okay, yeah. Well, and yours just happens to be a kind of a short list of results. Sometimes you'll get a whole page, and the further down you go, they hardly seem relevant at all. So yeah, once you find what you need, I wouldn't worry about that.
I got one other quick question as well.
Sure.
When I go into the EBSCO host, I notice that it doesn't give. Now, I don't expect it to have all the databases, but I notice that some of the databases aren't included. And I guess you kind of answered the question already. If we're out of this, then of course ref work doesn't always work. We have to do it kind of manually. But is there a certain area to actually add more? There we go. It's like I was just kind of surprised that there wasn't a more significant database. Because I know there's some, Joy, what was the other one that we were talking about earlier? Ovid
and ProQuest.
Okay, so I'm sorry, go ahead. Finish what you were saying.
Oh, no, I just everything I pulled up from Cochrane database. Alan, put on mute. Thank you. Everything that I pulled up from Cochrane was appropriate, but it took me out to Ovid, And then when I clicked to go to Ovid, it wouldn't open because it said it didn't have, I had either purchased or it wasn't a license. So I was going to try the citation matcher and see if I could pull it up that way, maybe through one of the others, but I haven't tried that yet.
Ah, very good. So let me just because this is a good. I think it's important. It may not ultimately be important to your project, but I would like to explain it. So Ovid, EBSCOhost, ProQuest, those are all database vendors. Okay, so your databases are things like Medline, Nursing and Allied Health Source. So no, not every database is available via our EBSCOhost instance. But what you're talking about when you go into, so like we do have some databases on the ProQuest platform, like ProQuest Nursing and Allied Health Source. If you go into that, that's a different database that you can search, and it's on the ProQuest platform. So now, like for things like Medline, you can search that via Ovid, you can search it via EBSCOhost, or you can search it via PubMed. There are just different ways. They're just different vendors for that one database. What you're talking about with Cochrane, though, I'm actually not sure. It's probably articles that were available through the Ovid platform. And I'm not, it should, if we have access to it, it should, our proxy information should have carried through, and you would be able to access it. The citation matcher is an excellent way to check that. But the other thing that concerns me about your question is that mostly when you search Cochrane, you should just be looking for Cochrane reviews. Cochrane will bring back a lot of other things that I don't think are terribly relevant, but I could be wrong. So do you want to tell me what you were looking for in Cochrane, and maybe we can kind of recreate that problem?
I think I was looking for, honestly, I've searched so many things I don't remember specifically, and I have them saved.
Okay.
Somewhere, but I believe it was like a systematic review. I think I was looking for that type of an article. Right.
That's when you're looking for a systematic review, you should look in our Cochrane library is the place to go. But do you know, like, did you just go in there and search for sepsis, or?
I think I went in looking for sepsis bundle.
Okay, I'm going to leave this at sepsis. So when you're searching for systematic reviews, you can be very broad. You don't have to be, although I may have to eat my words on that one with this such a common topic. Because there aren't going to be, systematic reviews are very lengthy, and they aren't going to have done systematic reviews on everything. So usually you can be much more general. Now, when it says that there are 9,906 records, but only 148 of them are systematic reviews. So see over here, it's only what is listed on the results here are only Cochrane reviews, and those should all be available. Any Cochrane review should be available through our subscription. So I'm not sure what you would have seen on here that would have led you out to Ovid.
Well, and honestly, I apologize. I can't right off the top of my head remember exactly what, but now I can go back in and maybe research and see what I come up with. Yeah,
and that's okay. I understand you guys have looked at a lot of stuff, but just
I have the link down here on my paper, but it's not going to take me anywhere right now.
Okay.
Okay. No, I'll relook and see if I can't, and if I don't, I'll reach out, or I'll try the.
This may be what happened here. So I did sepsis bundle, and so there aren't any Cochrane reviews. And so since there aren't any Cochrane reviews, it did go ahead and show you trials. And that yes. Okay. So the trials, this is just like a record to some other article. And yes, so it gives you the DOI, and that does not have our proxy information. So this isn't necessarily taking me to Ovid, but now I can see how you would have gotten there. And so, yeah, and so this is why, I mean, honestly, I've just not looked through these. Like, I'm not sure. Let's see. I think these are trials that, I mean, I guess they have something written up about them, but they're not completed. I obviously can't read that one. So yeah, that's why. So these are probably not. I mean, I would not really, when you're in here, make sure that your results are only showing Cochrane reviews. I don't think you're going to want to spend any time looking on. Although, I mean, I don't know. I guess I shouldn't say that because this multi-center implement of the severe sepsis. I'm just worried that these are not going to be. Oh, now that one did include the. That one did include our proxy information. I guess I need to find out more about what gets indexed in there that's not a systematic review. Because yeah, I don't want you to miss something that would be good. But my guess is this should also be indexed in Medline, but you may not have picked it up in Medline because of a different, just different searching that you would have done in there. But yeah, if you do have the citation or the link or whatever to that article, we could, if you want to get with me later, or or we can do it now if you want. We can see if that's something we have or not.
She'll be right back. She got locked out again.
Oh, oops. Okay.
So Cynthia and Sarah, we haven't heard a whole lot about your projects. Do you guys have anything you'd like to look up?
I have a question about mesh terms.
Okay.
So I'm not quite as familiar with them. I would say, for my past history of research stuff. So my project is HPV vaccines, and I found the correct mesh term for that. I found the correct mesh term, I think, for the shared decision-making models. But what I was wondering about is the screening and brief intervention and referral to treatment, which we would use the acronym for that of SBIRT or whatever it is. So would you look those terms up each individually? Is that the easiest way to do that, or?
No. So SBIRT does not have a mesh term, because that's one that comes up, over and over again as we do these sessions.
Because it's new.
It does not have a mesh term, and you can search by the acronym. So if you go in, I'm just going to do it as a keyword just to save time right now. But like if I do HPV vaccine and shared decision making and SBIRT, you can, just because people will normally, if they, and that's hold on just a second. I hate to just do it just by itself, but just so you can see, like if I just type in SBIRT, I'll get, like, I get 266 articles because people have used that in the title, or like this one, it's not in the title, but they must have used it in the, they'll say in the abstract, we're using SBIRT implementation. So yeah,
Okay.
if you already have a couple of terms in there, and then you add SBIRT and you don't come up with anything, it could be that those aren't that there just isn't an example of that one. But yeah, for the most part, that's been the best way I've found to search that, is just to use the acronym.
Okay, perfect. Thank you.
Yeah, sure.
Cynthia, Are you talking to the group? I can't hear you.
How about now?
Yes, gotcha.
Okay. I accidentally pushed the button. So I'm doing mine on postpartum, which is a huge, huge topic. I mean, there's millions and millions of articles, it seems like. So my question is more the opposite of what Joy was explaining, where she's not finding very many articles on some topics. How do you narrow down these huge topics, you know, when there's even when I put in the mesh terms, I'm still getting, you know, 500 articles, 400 articles. So do you read? I can't imagine reading every single one. I don't want to base it off of title because I don't want to miss something. So then I go to the abstract, you know, and maybe not. So is it just a time intensive, just keep on reading?
Nisa, I'm gonna let you answer that. I mean, we can look at some ways to narrow down your search. Because you're right, that is a broad topic. So now from your PICO question, so are you just looking at, I mean, for yours, you know, you probably can, you know, you can add a few terms. So let's do, so tell me what you did, like, did you just do postpartum care or did you use any other terms?
Well, I use postpartum care, postpartum, aftercare. I use postpartum discharge. I'm not, I mean, of course, postpartum depression is part of it. That's not really the part that I'm concentrating on. So if you look at postpartum, you get a lot of tools and things like the Edinburgh and PHQ-9 and things for postpartum depression. I want the more getting people into care, the discussing of contraception, the, you know, are you breastfeeding correctly? Are you having any struggles with support, that sort of thing, versus ruling out all that depression, because that's really, I mean, it'll be a part of it, but it won't be a big part of it.
Okay.
For mine, this might help you, Cynthia, because I kind of struggled with the same exact thing. And Alan, you might be able to relate to this too, because you're doing your project on pre-diabetes. But you know, diabetes is such a broad topic too, and I'm not focusing on my diabetes management. I'm doing more like clinical guidelines, like as far as, are they getting their flu shots? Are they getting eye exams, foot exams, and things like that? So I did my search instead of management. I would do, I did guidelines, and I found that using the word guidelines helped guide me a little bit better as far as what I wanted. So I don't know if that would help you or not, but I definitely could relate to what you were saying.
That's a little bit where I was getting into right before our session, is into some of the guidelines, and I thought, oh, okay, this is more of what I was looking for. So that I do think that that's going to help.
Yeah.
Yeah, I mean, you definitely need to have some sort of second concept to help narrow, you know, if you just look at postnatal care. So like I did postnatal care and office visits, and that didn't get very much. But you could look, I mean, you could look at the unintended pregnancies. You could also, like we could go to, so here I've done a search and I've got results, and then I clicked on advanced search, and this brings me to more limit. So it'll keep this up here, but will let me limit. So now there's not, and actually, I'm not sure this is going to be what we need. But I just wanted to check it. So there are things like, just for example, I mean, I'm not telling you to do, you know, just for an example for everybody, this is helpful. But to look at like these age-related limiters. So if, for example, you were particularly interested in young mothers, you know, you could do the young adult, you know, 19 to 24 years, and that would narrow it down some. So office visits didn't work. What's kind of the you know, so I'm looking at, of how to narrow it down to low income women. And I'm not sure what the term is for that.
Poverty was one.
Okay. Yep. There you go. Okay.
Okay,
so let's, so.
Because almost all of my patients are on Missouri Medicaid, or they have no payer source. It's essentially a free clinic.
Okay, so poverty and postnatal care. See, that gets us down to 77.
Mm-hmm.
And that's going back to 1971. So,
so if I just move the date up to a little bit more current.
Right. You could move the date, and then so if you move this to, even if we just take it to like, well,
10 years.
Yeah, 2007. See that? Yeah, that brings it down to 48. But now this looks right off the bat here. This one looks like this is a systematic review.
And I think
so
I have that one.
Okay, good. So again, we can look at the mesh terms. So you could use this. So they've used the method subheading with postnatal care. So you could try some various subheadings. They've used maternal health services, which is going to be broader, but that's something you might just want to keep in mind. So yeah, if you've got that one, that's a good place to start. Looks like.
Remember, Cynthia, that you can also look in the reference list for that systematic review. Sometimes
that's what I was also going to ask, if that was kind of a okay way to go about it, because I've been looking at some of the articles and looking what their references were.
Yeah, that's absolutely a great way to find other articles. And let me show you, I believe I showed this to the last class. Now this is relatively new, so this may not work, but let's go ahead and try it. So you've got this one good article that's great. So one thing you can do in EBSCOhost is go ahead and click on Find Similar Results. And what that does is take the words from the title and the abstract and do a natural language search. And so now this will give you relevancy ranked results. So these aren't in chronological order or reverse chronological order, but you can, so it kind of works really well or not at all. So you can kind of, this one to me doesn't look like it worked that well, because the first two are duplicates, and then we're getting into neonates, childhood illnesses. That's not really about the mother so much. So that didn't work as well as we wanted it to. But the other thing you can do, let me pull up this other window I had open here. So in Google Scholar, I'm going to search on the name of that. I'm going to search on the name of that article, and so it comes right up. But down here, it tells me that this article has been cited by 14 newer articles. So 14 other articles when they were written. Oh, I'm sorry. That still has the one we used in the last session. I'm sorry. Let's pull up your article. Oh, did I not even put it in there? My bad. Okay. Whoa, I'm totally messed up here. Let me, okay, I might not have copied it to the clipboard when I highlighted it. Okay, strategies for improving healthcare seeking. Now let's try that again. Okay, that is the article. Okay, that's the article. But now here, it's been cited by 10 other articles.
Okay.
So now I can just click on that link, and this is going to give me, and again, sometimes this doesn't work quite as well as you might have anticipated. Maybe they cited that article, but just kind of in the introduction or something they did, but sometimes it'll be almost a continuation of that study, or something that relies on it really heavily. And so again, even if you don't end up finding something to use, it's kind of one of those things that you want to check to make sure that you've covered your bases.
Okay.
So, Billy Ann, one of the things I saw in that long list that you had in your results was an article about barriers. It looked like it was probably a qualitative article about barriers to seeking postpartum care. Oh, I'm sorry, not this. It was the initial.
Yeah, when we just did postnatal care by itself.
I think it was postnatal and poverty.
Okay.
I think I have it too.
But those kinds of things, especially for what you're doing, like sometimes you may have to get a little bit, like what is it that you really want to do? You want to know why postnatal care is important, but it's not going to take you a lot of effort to write up your paragraph that says why postnatal care is important. So what is going to really inform your project? So what is the way forward? Like the way forward is what keeps women from going to their postnatal appointments? What are the strategies that have helped to encourage women to go to postnatal appointments? So maybe try looking for those kinds of things, that sort of pathway forward.
Okay,
choice.
I think I'm on the right track because I have several of these same articles already that she was showing me, and I think I'm in good shape.
Good.
Good.
Look at that, predictive factors for loss to postpartum follow-up among low-income HIV-infected women. But maybe, I mean, even though your women are not HIV infected, it may be that that has nothing to do with it. Like when you really look at the article, it may be that that the same factors also affect your women. So those kinds of things are worth glancing over to see if there's something, you know, oh, hey, look at this piece of information.
Right, and what's interesting to me about this is see, this is a mesh term that we didn't think about before, and it's continuity of patient care. So you might try combining this continuity of patient care with the postnatal care, because that's kind of the issue. Is like it seems like that's what I hear you saying. Is this is, you know, they're your patients, and how do you get them to, you know, you want to give them continuity of care, but they don't.
Right, that one and the loss to follow up.
Yeah,
right.
they're not doing their part. So how do we, you know, so that seems to be a part of the issue. So that's a good term to use. And why is it not?
And the term
yeah, there we go.
was,
81.
The term below it was loss to follow up. So that might be another good one to consider.
Because my initial project started out, I wanted to do postpartum care with the high-risk illicit drug users, because Missouri, yay, we're number 3 with methamphetamine use, and heroin is right up there in the nation. So we are seeing a huge population with that. But when I spoke with Dr. Giles, she was like, are you seeing 3 or 4 a week, or are you seeing 3 or 4 a day? And she was more concerned about getting the numbers if I just concentrated on the postpartum. You know, we kept pretty close tabs on them during their pregnancy, but then with the illicit drug users, do they fall back off the wagon during postpartum and that sort of thing? So she wanted me to concentrate more on the high risk patient in postpartum care, and the illicit drug use would be just a portion of that.
Yeah, that's always smart to keep to make sure you have enough patients that what you're doing, you're putting a lot of effort into this project, right? And so it has to serve enough of the patients in your practice for it to be worthwhile to put in so much effort.
Well, rarely do we have a normal OB patient in our clinic.
Yes.
Yeah, I heard you, Nisa, I heard you say that. I had not noted, good eye on that. I had not even know. I was so, I was focusing on that continuity of care, and I didn't see that loss to follow-up, which was fascinating. I've never seen, I don't think I've seen that one before. So I looked at the scope note, and it is apparently specific to study subjects and cohort studies. So that's a good use of the scope note, but so it may be a little too specific, but definitely worth a shot, and that's very interesting. But also because I did that relevancy ranked search for it, I found some other things that, again, may not really be helpful, but are kind of interesting, like this duty to recontact. Again, it's kind of more about research studies, but I'm just really kind of fascinated about it. Sorry, I know you guys have more distinct things you're looking for, but you know, it's good to, again, if you know, we might try these and just see if you needed to. Sounds like you're on the right track, but some more things to keep in mind.
Okay.
I have a question.
Sure.
So is there any way to search for a certain type of study, like a randomized controlled trial? Is there a real easy way to look for that particular type of study?
There is indeed. I'm so glad you asked. So let's go ahead. If I still have it in the search history, let's pull up your specific topic. So yeah, let's just look at this We can go right to the results. Okay, so let's say, we did this drug resistance, microbial, and urinary tract infections. Let me collapse this search history because it's getting in the way. And we came up with 1,600, which obviously is a lot. So if I click on advanced search, these are the search limiters that I talked about before, and I can go down here to publication type, and randomized control trial will be one of these. They're in alphabetical order, so I have to go for a while, but randomized control trial is one of the options. So now when I run this search, it's doing those two mesh terms, but only looking for ones that have randomized control trial in the publication type. So yeah, so that took that, that 1,600 down to 38. So yes, you can look for different various publication types using that limiter.
Great, thanks. And I saw there was one for like meta-analysis too. So there's most of the study types are in there. Okay.
Yeah, exactly. Now, I thought I'll go ahead and talk about it in case anybody else has the question. Because when you started asking your question, I thought you were going to ask about qualitative versus quantitative studies. There are not any limiters or any specific terms for that in Medline. If you use CINAHL has a subject heading. They have one for qualitative studies and one for quantitative studies. We're a little hesitant to rely. That will, if you have a broad topic, that will definitely help you narrow it down. But we're a little hesitant to use that, to rely on that, because we feel like there are some qualitative studies that don't get, that don't always get assigned that term. So really for the qualitative, you kind of have to look at the abstract and see what the methods are and see if they use qualitative methods. Again, if you've got if it's a really large search, a broad topic, you can throw in qualitative as a keyword. But you're only, if they say in the abstract, we did this qualitative study or this qualitative study found blah blah, then that will come up if you use that as a keyword. But just keep in mind that's not going to be that's not going to get you everything.
I found when I searched patient experience with my topic that's when a bunch of the qualitative stuff came up, because that seems more like interview based and that kind of thing.
Yes, exactly. Very good. Yeah, patient experience, a lot of times if it's qualitative, they will have done an interview, so that, that term will be in there. So yes, that's great.
Thank you.
Sure.
So does anyone else have any questions they want to ask right now?
Actually, a quick question, if I may, on RefWorks, and I apologize if I missed this, but when I downloaded RefWorks, I apparently downloaded the legacy version. Is there a difference or a benefit into having the blue one instead of the orange one?
Yeah, no, I'm glad you asked that. We can only use the legacy one right now. We are not set up to do the new one. So we're trying to get that to where it doesn't give you the option. So I apologize if that was confusing, but yes, legacy is what you need.
Excellent, thank you.
You're welcome.
Very good. So the only thing I still wanted to talk about really quickly was just where you're going with this literature search. Because right now you're just like getting as much information as you can, going through all the checklists that we gave you, kind of a nice broad search just to figure out what's out there, right? But pretty soon we're going to be narrowing this down. And when I say pretty soon, like we're starting week 3, and on week 7 you're going to be turning in a charter, which is actually just a whole lot closer than it sounds. So the way I want you to think about this is that right now you're searching really broadly. You started off by figuring out like what are the needs of this site, right? And kind of thinking about what is a project that the site needs. Now you're going to let the site dictate the topic, and then now you're going to let the literature dictate which direction you go from here. So a lot of the time we sort of develop a plan in our heads and we try to find the literature to stack up to support our plan. But I'd really like to challenge you to do this the opposite way. I'd like to challenge you to read the literature and follow where it goes instead of trying to stack up a plan for what you already want to do. Then once the literature is taking you a certain direction, I want you to look for things that really support it. We always say don't reinvent the wheel, but we mean it. Look for things like guidelines and established practice plans, all of the things that will say this is the right way to do it. And here are some really good tools already out there. So if there are toolkits, if there are things like that that already exist, you may have to modify them to fit in your site at some point, but get those things and really incorporate them into what you're doing. You shouldn't be developing something that's never existed before. The problem, or the solution for your problem is likely already out there. I doubt you're the first person to come across this. You might be, but I bet that a lot of you aren't. So then once you've kind of figured out, like, you're just going to keep narrowing from there, like following that guideline. Oh, look, here's this toolkit that already has all of these forms that are, and you're going to sort of develop a project this way, always keeping in mind, where's the literature taking you? What does your site need? Those kinds of things. Does anyone have any questions about limiting or how they would actually develop a project out of all this?
I'm just kind of struggling with mine because with my site, they want kind of like not really a full diabetes education class, but more of a like individualized sessions, just to make sure, because a lot of times in the office, we don't have time to do really good like diet education and things like that. So just an individualized plan as far as like what are the patient's goals, like what do you want from this with weight loss, like I said before, like flu shots and foot checks and eye exams and everything. But, you know, realistically, that may not be a possibility. So I've tried to go more across of like giving providers a toolkit to, or like a checklist to be able to say, okay, you've had your eye exam this year, you're good on that. We're doing foot exams every 3 months, and, you know, so on and so forth. And then just get them to like some sort of individualized plan, not necessarily like taking that on, but just guiding them in the right direction to where they can get educated. So I'm just kind of struggling like with what my site wants and what's really feasible.
Yeah, so take a look at some of the diabetes toolkits that are out there, because you may find that that something like this exists, and if it doesn't, it certainly needs to. We use a lot of shared decision-making tools and decision aids in this class, and you'll see, even though the formats will be slightly different because your patients may not be making a big decision about their care, you'll find similar things. And so if you can't find the exact form that you're looking for, I think take something that's close and adapt it. But definitely there should be a way of this patient's care, and then we're going to personalize you in 5 minutes. We're going to look through this and say, yes, you should go to a diabetes education class, and yes, you should have a foot exam and eye exam. We're going to create a plan to get all these things to you.
Okay.
Rachel, I'm gonna jump in real quick, because like, since my clinic, sorry about the echo, my clinic already has a program for diabetes that we do a checkoff list already. So we do, have you had your pneumovax? If they haven't, then we're going to refer because they're recommended. Have you had your flu shot? Have you had your eye exam? Have you had your foot exam? That's already formatted. What I'm trying to do on top of that, so with kind of what you're looking for, you can even email me and I'll kind of show you exactly, just kind of give you an example of what exactly my list is. I also have that for asthma, what they recommend, and are they doing inhalers, do they have a rescue inhaler, that kind of thing. So we've kind of already got that set up. I'm trying to kind of use that with my pre-diabetes, but we absolutely have something like that already for at my clinic, so that we use on any diabetic that comes in. And then we have a Take AIM diabetes program. So just to let you know, if you want to reach out, I can kind of, at least if you don't find that, I can give you what we're using.
Yeah, that would be great. That would be great.
Yeah, that kind of sharing is perfect. So if you can see what's been used at Alan's clinic, and my guess is that if it's in use at Alan's clinic, I bet there are lots of these kinds of forms. And so it'll just sort of turn you on to a new idea, like, hey, look at all these things out there. You scour them, you find the best one, take it to your site and say, this is a really great thing. We're going to use this to personalize care for each one of our patients. And in many ways, that may sort of lead you into your patient engagement portion of your project.
Right.
So anything else? I will tell you guys, I wish that I had the perfect like 2-minute thing to say that would help this to sort of all come together for you. the problem, I think, for me at this point is that I understand where your projects are going to go, and I find it really exciting. But it's hard for me to remember exactly what all you need to hear from me. Like, exactly what did it feel like to not quite understand where this project was going to go? And I'm not sure what to say, except that I know your projects will come together. I know you will do this. And my advice is to take your time with those IHI videos, go back and watch them again, really think about what they are saying. It is really tempting to just take the test and it will tell you which answers are wrong and you can take the test again. And I know you're all looking at me like no one's ever done that before. But I will tell you that every term I have a handful of people who do this kind of thing and get real stressed out when none of it ever makes sense to them. So try to really watch those and think about your project from that perspective. That all the way through, you're going to be looking at, at how your project, how all this information that you're finding now, all these things you're excited about and want to implement, how they fit into those ramps. And actually, Billy Ann, for whatever reason, that led me to think of one other question for you.
Okay.
One of the ramps that all of our students will have to incorporate into their project is a way to get the staff excited about this. We'll have a whole ramp that's just about staff engagement. And so I usually encourage them to look up in the literature something about how do teams get, how do we make a team? What is team building? What is team engagement? And I have not actually ever done this kind of search exactly, or I haven't in a long time done this kind of search for it, but I'd love to see what we find real quick.
That's very interesting. So in MESH, I just looked for team building and they came back with patient care team. I'm not sure that's exactly, that's what we're talking about is a patient care team, but, we're looking at, things to do within that team. I'm going to check in CINAHL. They may have some better terminology for that. Honestly, that is the kind of stuff that you will find a lot about just doing a Google search. You'll find, it may not be specific to nursing. You may find that kind of stuff about more corporate entities or whatever. So that stuff is definitely out there in the business literature. But yes, it would be nice to find something that was specific to a, to your situation. So let's see.
Yeah, I definitely agree with you about Google searching those kinds of things. It doesn't really matter if you find a really great system for how to engage teams. It doesn't really matter if the people who wrote it were talking about airplane mechanics or what they were talking about. You want your team to be excited about doing more work. That's challenge.
Yeah. So okay. So I was right. CINAHL does have a term for team building, and so here's one. So you can see this comes from a periodical and not an academic journal. But again, in this case, we don't we don't care. Employee engagement is important to your practice. Let's see here. And now some of these, so I would like to use, let me see if they also have, because this is still pretty broad. Let's see if they have patient care team, and then oops, misspelled team. So it didn't like that. Oh, sorry. If we could combine the two, patient care team and team building, that might, yeah, it's okay. So see, in CINAHL, it's slightly different. Instead of patient care team, they use multidisciplinary team. So let's combine that with team building. And that might be more what we're looking for, hopefully. Okay, yeah, still 219. So using teams to improve, and looks like a typo. Using teams to improve performance, I guess is what that should say. Mastering the use of teams in healthcare organizations can maximize outcomes and optimize the use of resources. So yeah, it looks like there is definitely some stuff out there.
Yeah, a lot of this just looks exciting to me, just kind of glancing at it. Things like, let's see, higher up a little bit, I think there was something that talked about, oh yeah, competition versus collaboration in healthcare teams. And so we have, I don't know exactly where that would lead us, but we have a lot of students who do, who pit teams against one another intentionally. So maybe each provider in your practice has their own, you know, MA, nurse, whatever, like a little team for themselves. And maybe you do some comparative stats and everyone on the winning team gets Starbucks or something like that. Like, you can do things to engage your team, or you can huddle. Like huddles will probably be a search term on one of these.
Oh, I just want to, also teamwork is a subject as well. So, you know, just the slightly different than team building. So yeah, we can do huddle. Creating a morning huddle to get everyone in the same movie. There's only that one, but so yeah, like you might do communication and team building. That's another good. Yeah, this doesn't have an abstract, but I bet it's just a short article here. So yeah, I mean, there's definitely stuff that, yeah, this looks like maybe just an abstract of some sort of presentation, because it's not even a full page. Yeah.
But definitely don't forget to literature search all of the things that you're doing, not just the things related to your patient care and your interventions. And another good thing to do for that, as you're looking through, think about looking at our past student presentations. Sometimes you'll find really good ideas for team building there. One of my students last term did something, I think it was Starbucks for Stars was what she called it. But
oh, cool.
Winning teams and winning individual participants, people who were, you know, did exceptionally well on the measures that she was tracking. And you'd have to look, as you develop your measures, you'll look at what you can track really well. But those people would get sort of surprise little Starbucks here and there, and everyone could see it. Which is, you know, can do a little social science research and look at what motivates people, but watching someone else get a prize is certainly motivating.
How true. And just in case you didn't know, so if you're on the library home page, you can go to the Frontier Digital Depot and look under DNP projects, and that's where you can see the former projects from those who have gone before you.
All right, very cool. Well, do you guys have any other questions? Anything you think Billy Ann can help with today?
If you think of questions later, don't feel like this is the only time you can take advantage of the library faculty. So you can give us a call here, and we're happy to answer any questions you have.
Awesome. Well, thank you so much. This has been really great.
Yeah, you're welcome.
Thank you.
You're welcome.
I learned something every single time.
Okay, I hope you keep saying that. You're gonna yeah, be at a few of them.
Well, I would hope that at some point I stop learning something. You'd think that I would just know some of these things by now.
Well, yeah, I guess that's what I meant. Like, wow, I'm not sure I have many more tricks to pull out, but yeah. Well, good luck to you guys on the rest of your projects.
Thank you.
Yeah.
Thanks.
All right. Thank you guys for coming and being
you.
well prepared. I look forward to hearing more about your projects in future weeks to come.
Talk to you later.
Bye-bye.
Bye.
Bye.
Bye. Bye.